Welcome. Let's take a look at our top story. Witnessing a sudden spike in the daily number of coronavirus cases, Tokyo is on a red alert. This is the highest level of alert under the metropolis system in Japan. Alarmed by the rise in the daily number of cases, Tokyo Governor Yuriko Koike has described the situation as rather severe. The red alert level however, does not mean that Tokyo will go under a lockdown. Businesses in the city can continue operations and public events need not be postponed. Japan is one of the few countries which didn't impose a complete lockdown and still managed to contain the virus spread in the earlier phases. But health experts across Japan have raised red flags now. They have warned that infection levels, especially in Tokyo, were exceeding peaks. The capital city witnessed over 200 COVID-19 cases on a daily basis over the past 1 week. A record high of 243 new cases was reported on Friday last week. With a slight decrease, the number of new cases reported on Wednesday was at 165. The number of people needing to be hospitalized was also to be on the rise in Tokyo. Koike said that the plan was to proactively conduct more tests to contain the spread. Authorities have urged people to avoid visiting restaurants. The local government also plans to offer subsidies to those nightclubs which shut down willingly. As per reports in the local media, residents in Tokyo have been asked to avoid visiting parents and relatives living in rural towns which have reported fewer cases. Cases have been on the rise in other cities in Japan too. Osaka reported 61 new cases on Wednesday. It is the highest daily spike since the 20th of April. The government campaign aimed at boosting domestic tourism has faced backlash in Japan. Local municipalities, opposition lawmakers and citizens in general have urged the central government to suspend the campaign. Japan's economy minister, however, has said that the government will cautiously proceed with the campaign. While the government is looking to promote intra-Japan travel to help the economy, Japan's international borders still remain closed. Japan has until now reported over 22,000 coronavirus cases and close to 1,000 deaths. For more on this, Grace Lee is getting us a ground report from Tokyo.
There's that big question of how will Tokyo, the epicenter of this outbreak, deal with it this time around? Now, last time, the state of emergency, that was largely a polite request from the government for businesses to shut down and for people to stay in their homes if possible. And we did see a lot of Japanese businesses and citizens here go along with that request, and that's how we saw that infection level subside. This time around, we're seeing a similar measure being put in place. The red alert at the moment is just simply the governor asking people to take more precautions, but experts are saying that's too vague and that she's simply asking people to be careful without giving them very straightforward guidelines. Yes, you should avoid nightclubs. Yes, you should avoid restaurants that aren't taking COVID-19 precautions, but at the same time, it's really not enough to make sure that we see those numbers go down gradually in the next few days. Well, both Governor Yuriko Koike and the central government have said that they don't want to do another state of emergency in fear of hurting the economy even more. But as you mentioned before, it does feel like residents here are being pulled in two different directions. You have the local government asking them to refrain from going out, to refrain from activities for now because of the spike of infections. But at the same time, you're hearing from the central government who is pushing ahead with this go-to travel plan. It's a promotion that will give subsidies to travelers who are traveling domestically. So they are being asked at the same time to go travel and support the economy, and that's sending some very mixed messages. Now, the big worry here is that residents here in Tokyo will take on that request from the central government, go travel to rural areas and spread the disease to places where they have a limited amount of hospitals, limited personnel who can deal with COVID-19, and the spread of the virus there will be especially devastating.